West Tennessee Today has been covering local politics almost to the extreme, but we also stayed abreast of statewide political races as we approach early voting, which is just a matter of days away, and then, of course, the general primary final general election will be coming our way the first week in November. And we're pleased to have with us here on West Tennessee Today the Democratic nominee for governor in the state of Tennessee and the former mayor of Nashville, Karl Dean. Mr. Dean, it is a pleasure to have you with us.
Thank you. It's great to be here.
We want to get right into some of the key things. First off, just because you've been all over the state, I was here when you were at the farmers market and were joined by your former opponent, Craig Fitzhugh, and you were having a message that you were getting across to people. What is the message that is coming back to you from people across this state that they're telling you as far as their perceptions of the most pressing needs that we have?
Well, I think that if you talk to voters, the two issues that I think come up the most are education and healthcare. I think education, and I think this is a real positive thing about Tennessee, is that we're at a stage, and I think we've been here for a while, where most people in Tennessee correctly perceive that public education is the absolutely essential thing for our state's long-term success. I think there's pride that we have made progress over the course of the past years, that we have had two governors, Bredesen and Haslam, who've worked really hard on this and have made a difference, but we've got a long way to go. And I think there is the willingness and the desire for continued investments in education and a continued focus on it. And the desire, which is natural and very healthy, that people want their kids to get a good education. I think the healthcare side of it is more complex. I think there's probably a little less so than about a year ago. I think a year ago, during the midst of some events that were occurring in D.C., there was lots of apprehension around healthcare and how it was going to be paid for. I think now there remains some apprehension, but it's mainly focused on what people can see as problems with rural hospitals closing, the fact that we have lots of people in Tennessee that are uninsured, and there's a desire to see us be sort of more thoughtful and proactive in the way we approach healthcare.
We're going to follow up on both of those things with some specifics. When you were here earlier this year and participated in a forum with candidates from both parties at Lane College.
Right.
One of the key things that came up as a question was about funding for public education in rural counties, that often we're seeing a lot of the small towns sadly beginning to, people fear, wither away.
Right.
And how are we going to get to a point that rural West Tennessee feels as though it gets its share of the education pie? How do we get there?
Well, I think one of the things we have to do is look at how we fund education across the board to make sure that all students have access to quality education. Then I think we have to look at the economic health of every community. And the concern in West Tennessee is justified. I mean, you look at West Tennessee and you have numerous counties in West Tennessee that are losing population. And when you're losing population, that means that your tax base is going away. That means that it's more difficult to fund education, more difficult to fund public safety and libraries and things like that. And it kind of builds on itself, because once you start making cuts because your tax rate's going down and you can't fund what you have, that makes it even worse. So I think we got to do two things. We got to focus on economic development for West Tennessee. A key component of that is education. Workforce development, having the workers here that can do the jobs that we can bring to this area is vitally important. We've got to make bringing jobs to West Tennessee, rural West Tennessee, a major focus of our economic development department, and make sure that we're succeeding there. And I think by doing that, you create the atmosphere where you're going to start seeing the health return to towns. Healthcare is part of this too, though. I mean, you can't ignore the fact that when a hospital closes in a small town or in a county,
one of its biggest employers.
It's one of its biggest employers, but it makes it, for the chamber people or for the people doing the business recruitment, it makes their jobs very hard. And when you lose a hospital, it's hard to retain your citizens, and it's hard to attract new ones. So, I mean, I think the entire health of the community, healthcare-wise, education-wise, and economically are what we have to focus on. and we got to make West Tennessee a priority.
You have talked about, where it comes to health care, you favor expanding Medicaid, and that was an issue that, frankly, Governor Haslam tried to come forward with a plan, and the legislature rejected it. Let's say, for the sake of discussion, that this remains a Republican majority legislature. How would you work to try to get a plan through that legislature that has rejected expanding Medicaid?
Well, I think first I would approach it with the idea that we got to work together, that it's not about, me trying to ram through a plan, but it's saying, look, we now can look back at the decision that was made by the legislature not to really give a chance to Governor Haslam's plan. And we can look back and see what the ramifications of that decision were. Well, we know that we've had hospitals close. We know that we have lost about $4 billion that could have been used to offer insurance to people. And we know that we have 300,000 people, mostly working people, without access to insurance. And that's not a good situation. So let us together, the governor and the legislature, work together to find a way to move our state forward. And I think if I'm elected governor and I've run for a year plus talking about Medicaid expansion, that's going to be a good indication of where the public is. And we know where the public is. I mean, if you look at polling done by Vanderbilt and other organizations, well over 60% of the people in Tennessee support Medicaid expansion. And then I would make the argument to them also that in terms of fiscal responsibility, it is not right for us to take send money up to D.C., our tax money up to D.C., then have them distribute it to 34 other states to pay for their Medicaid expansion, but then not to us. I mean, so this whole question of, do you want Medicaid expansion? And somebody says, well, I don't want to pay for it. Well, you're already paying for it. You're paying for it everywhere but Tennessee.
I want to follow up on one part of that, and that is an issue that, frankly, I ran into with my own mother. You talk about discussions with Washington as to how we're going to have changes. My own mother broke a pelvis in 4 places during the course of the early part of summer. And at one point in time, without having to go to bat with some of our key people in Washington, she might have in 6 days basically been kicked to the curb. We managed to get her into a care facility that could handle her rehab. But one of the key things that kept coming back to me over and over again was that the health care and insurance situation in Tennessee is a mess because of so many providers that have pulled out of offering coverage. How do we negotiate with Washington, and how do we get ourselves back on track, particularly for our senior citizens, not to be in danger of not having the help they need?
Yeah, I think if you take the rational steps, such as Medicaid expansion, you make working on these healthcare issues a priority, it can level out. I think just look around us. I mean, look at Kentucky, look at Arkansas, look at the state of Virginia, which just did Medicaid expansion. I mean, not all their problems just went away overnight, but they're not like us in Mississippi, which are looking at hospital closures and more extreme healthcare issues. We've got to put ourselves in a position where we are getting our fair share of Medicaid dollars. We got to put ourselves in a position where we are competitive with the states that surround us. Right now, we're just not, because we're making decisions that are more, I'd say they're more political or emotional than they are rational. And rational decision making is always the best.
I want to bring up one issue that really bridges the gap when it comes to healthcare as well as education. And that's an issue that many teachers have talked about. We had the Tennessean to do an extensive report on this recently about the fact that because we are seeing an exponential increase in mental health issues, depression, PTSD, anxiety, that is happening with particularly teens. And it goes down even maybe into the 12-year-olds that are still in middle school. But the fact that our schools in Tennessee are sorely lacking in the amount of mental health counselors. It used to be the fact that you went to school and your counselor was a career guidance counselor. But in our contemporary day, they don't have the mental health counselors that are available to handle all the needs. How do we get to a point that we start chipping away at that problem? Because that does not seem to be something that's going to go away.
No, I think having, particularly for kids who are at risk, having more access to school nurses, to mental health help is important, and we got to work through ways to get that done. I mean, obviously there's a cost to that, and you have to figure that out. But I think having particularly young people who are increasingly looking for that sort of support, putting us in a position where we can provide it is something that we should be striving for. I think it's a good point. I mean, you look at things such as depression and suicide rates and other things, it's a real concern.
Final question in this segment, and that has to do with something that is on the mind of every single parent in this state and across the nation, and that is school safety. We, in fact, did a half-hour documentary on school safety in Tennessee. We also went across the border to Kentucky to the 2 schools that in the last 20 years have had active shooters. And certainly what happened over in Benton County, Kentucky earlier this year was a wake-up call to so many people on this side of the state in particular. I know there are a lot of grants available for school systems, but from the state level, what do we do now and what do you favor as far as continuing to do more things to ensure to parents that my kid is safe when he or she goes to school?
Yeah. Well, I was, when Sandy Hook occurred, I was mayor, and the first thing we did, working with the school board and the Metro Council, is to speed up the availability of capital funds to do safety improvements to buildings. I think that's key, and if there are, that should be done across the state, and if there are jurisdictions that have issues about paying for that, then the state can be helpful on that. I think we need to look at having more resource officers available in classrooms, whether it's retired sheriff and police or others trained for those positions. We can look for ways of doing that, and that to me is a justifiable expense. As you say, there's no issue more important, there's nothing more important than the safety of our children. Unlike my opponent, I do not believe that we should be arming teachers. I think that is, when I talk to teachers, that is not what they think is the solution, and I don't think that would add to the safety of our community.
We're going to keep you here for another segment, and we are going to come back with former Nashville Mayor Karl Dean, the Democratic nominee for governor, and we're going to be talking about issues involving crime and also more about economic development in the state, and that will be on our next segment with Mr. Dean on West Tennessee Today.